Welcome to a new episode of Reframe Your Health. Today we're kicking off the series of guests, and in our first guest series, we have a good friend, a colleague, and a double board certified OBGYN and infertility specialist, Dr. Laurice Bou Nemer.
Hi, Youssef.
Welcome to our podcast. You're gonna be our first guest, and there's no better way to kick it off than having you on our podcast.
I'm happy to be here.
So we usually make our episodes short, concise, fun. So we're gonna dig in straight into the fun part. So as an infertility specialist, are you seeing more and more couples struggling with infertility?
Absolutely. Part of it is because we are waiting longer as women to have babies. We have the freedom of being professional women, but that also means that we are delaying having children. And as we age, everyone knows it gets harder to get pregnant. That's part of it. Another part of it is not everyone who does IVF and not everyone who sees a fertility specialist is someone who is, quote unquote, struggling with infertility. A lot of women now want to come and see a fertility doctor to freeze their eggs early on. A lot of couples come to me as a couple and they just want to delay having children, and they choose to freeze embryos to freeze to sort of preserve their fertility. A lot of couples also find out that they carry a genetic mutation that they want to avoid passing on to their children. So they also can choose to do IVF with pre-implantation genetic testing to improve their odds of having a healthy child. So there are so many reasons to come to a fertility doctor, and not everyone who's doing IVF has infertility. So yes, we are seeing more and more couples who are conceiving with in vitro fertilization and other fertility treatments as well.
So age is a big thing. Everybody, as you mentioned, nowadays is delaying having a family because they want to pursue a career, etc., etc., etc. But are there other factors that you think are contributing to couples struggling with having kids? Are there anything that we have done as a society throughout the years that is making it difficult for us to have kids?
Absolutely. Part of it is the obesity epidemic. We know that being obese, which is defined as a BMI of 30 or above, increases your chance of having difficulty getting pregnant, increases your chance of having miscarriages. Also, our lifestyle, our environmental exposures are not helping. Studies are sort of ambivalent on this, but we know that exposure to chemicals in the environment, in what we eat and what we put on our skins, all of these can be harmful to your fertility as well.
Yeah. So, I mean, I see it quite often also in my practice. When people get to you, they get to you towards, the ones who are struggling with infertility, they get to you towards the end where they have tried on their own, didn't work, probably were shy to kind of ask if this is something normal or not normal, delayed asking a healthcare professional. And then they come to us, they ask what's going on, and then we sometimes investigate, and then finally they get to you towards the end when they're really struggling to conceive. Now, you as an infertility specialist, what would you like from other providers that are seeing the patients before you to educate them before it comes to this stage, before it becomes a problem that they're already struggling? What would you like from a general OBGYN to educate their patients about their fertility?
Thank you so much for this question, because it is one of my, it's one of my goals, why I come to this podcast, why I am putting myself out there on social media to be more accessible to the public, is because fertility doctors tend to be seen as a last resort. We're not a last resort. We are available. We are in your city, we are in your town, and you can schedule an appointment with a fertility doctor even if you haven't exhausted your options. You can come to the fertility doctor as a first choice. That's number one. I would like OBGYNs and other providers to be able to identify the patient who needs to talk to a fertility doctor a little bit sooner. We are seeing patients sometimes after they have completely burnt out emotionally and wasted years trying and failing, and they get to us by the time they are exhausted. And OBGYNs and providers can identify these patients early on. When you're seeing a woman who is in her 30s, hasn't had children yet, maybe you want to ask her, is having children in your goals? Are you currently in a relationship? Are you trying? Are you in a same-sex relationship, right? So identify these patients in their 30s. The early 30s, for women who are not trying to get pregnant actively, and women who are not planning to get pregnant within a year or two, the early 30s are a great time to preserve your fertility. So your patients who are in their early 30s, who are not trying to get pregnant actively, maybe these are patients who want to talk about egg freezing or preserving their fertility otherwise. Your patients who are in their mid to late 30s, these are women who need some counseling if they're planning to have children and not working on it yet. If they're working on it and if it's not working out, and if they're trying and it's been 6 months and they haven't achieved a pregnancy yet, these patients need to be seen by a fertility doctor. This is not the time to say, just adjust your lifestyle, just keep trying, just relax and it will happen. That is not a good advice to give women. Providers should not tell women to relax and it will happen. First of all, no, that's not true. And that's putting a lot of blame on the woman and asking a woman to relax when she's very frustrated because she's trying to do something and she's not getting there and it's out of her control.
Yeah. It's important that you mentioned this. So I when I see someone for the very first time, no kids in their early 30s, at the end of the well woman check, I ask this question, and the majority of women look at me in a weird way, as in, why is this guy asking about this? And obviously it's the first visit. You want to break the ice with somebody that you've never met in your life, and then I go about telling them that the reason why I'm asking is it's something to think about, it's something to consider, because if someone is in their early 30s, no kids yet, no partner, or if they have a partner that they just want to travel the world with and they want to explore traveling and seeing things and career, etc. I always tell them that think about your the timeline and when you want to have a baby, and start considering maybe if you want to freeze your eggs. So and then at the end of the conversation, I see a nice smile at their face, because nobody has ever discussed that with them. So that's, if there's one important point that we want to get out of this episode, or one of the few points that we want to get out of the episode, is for people to talk about things, discuss it with their doctor, ask them about fertility, ask them about the planning. Now more patients are asking me, given that somebody who's not trying to have a baby, not in a relationship, they ask me about checking their fertility. I know this is a big topic. I know you probably get this question a lot of time. For somebody who is not actively trying to have a baby, who is in their early 30s, not ready yet to freeze their eggs, but they ask about checking their fertility. I personally say, the best test for fertility is to try. However, they don't have anybody to try. They don't want to try. What should we tell these people?
Okay. So if you ask 10 fertility doctors, you're probably going to get 10 different answers about that, because we have different preferences about that. Let me tell you one thing. There is no fertility testing, right? The only test of fertility is trying to get pregnant. the large majority of my patients are perfectly healthy. They have perfectly healthy lifestyles. They are taking care of themselves, and they're trying and they're doing the right thing, and they're taking their vitamins, and they're still not pregnant. That's unexplained infertility. That is very common. Now, for patients who are asking for fertility testing, we can definitely do fertility testing with the caveat that if your fertility testing is normal, that does not mean that you are fertile. That does not mean that you are not going to struggle with infertility later. And fertility is a team sport, right? It takes, egg and a sperm. So when we check the woman, she has to know that 1/3 of infertility is male infertility, right? So we've checked her.
Probably more.
Yeah, I mean, so if we check her, we haven't checked the other half of the equation, right? And as far as what is fertility testing in a single woman who is not trying to get pregnant, well, essentially you're checking the uterus, the fallopian tubes, and the ovaries, making sure she's ovulatory, and checking the ovarian reserve. One of the concerns with checking ovarian reserve at the OBGYN or the primary care's office is that a lot of time people are checking the ovarian reserve. AMH is 2, AMH is 3. They tell her your fertility is great. You have all the time in the world. You are great. There's nothing wrong with you. If she's trying to get pregnant, tell her keep trying to get pregnant. It's not you. And while AMH is an important tool in the fertility clinic, AMH should not be used as a measure of quote-unquote fertility, because it is not. And if you want to use it to reassure the patient about her ovarian reserve, or to sort out who has a low ovarian reserve early on, who may need egg freezing more than another, we can do that, but we cannot be reassuring patients about their fertility if their AMH is 2.
Yeah. So the way I see it, how I explain it to my patients, because I get this question all the time, I always tell them, as you mentioned, that because they're always asking about the AMH. Everybody's asking about this specific hormone. And I tell them it's one of the markers of your ovarian reserve. It's not a comprehensive test. There's additional tests, and there's an ultrasound that you can couple it with to kind of have a better idea of the ovarian reserve, but it's not a test for fertility. Because I always tell them you can have the best ovarian reserve in the world, but if you have blocked tubes, if your uterus is not, the incubator is not good, if the partner has issues, then it can be difficult to get pregnant.
Absolutely.
The only place where I see this very helpful, again, as a basic ovarian reserve testing, is if someone in their early 30s, no kids yet, no partner yet, and we check it routinely, keeping in mind all the caveats, is that if I find a lower, I send them to see you earlier.
Exactly.
I tell them, work on things earlier. If you don't have a partner that you wanna freeze an embryo, probably go freeze your eggs, etc., etc., or at least plan it, because egg freezing is not something you just walk into the clinic and you get it done. A lot of women need to plan ahead, need to plan financially, psychologically, etc., etc., etc. So that's where I find a ovarian reserve testing helpful for a non-infertility setup.
Yeah, and I agree with that. ACOG, to be clear, ACOG does not recommend checking AMHs. ACOG is the American College of OBGYN. They don't recommend checking AMHs right and left, and for people who are not trying to get pregnant, and for people outside the fertility clinic. Now, if we do it in a reasonable way, which is what you're describing, checking AMH to be able to counsel the patient about a potential low ovarian reserve early on, catching it early on so that they can plan their fertility ahead of time, that's the right way to do it.
Yeah. Now, the other big point that I wanted to raise, we started by talking, how more and more couples are struggling with infertility, age is being the big factor, but also exposures, what we are being exposed to as men and women. That could be affecting, we hear about the declining birth rates, declining sperm count over the years, big thing now all over the news is, the presence of microplastics in ovaries, testes, semen analyses. What is the role of the general OBGYN and you guys as an infertility in counseling people about these toxic exposures, and how should people prepare their body if they are trying to get pregnant, whether or they're not struggling with infertility?
Right. And that's part of it is the fertility doctor, but we are the last step. You all see them much earlier and then we do. The primary care seeing them, the pediatrician seeing them. A lot of people are seeing them before they get to us. And that's not something, you can't change your lifestyle in 1 week, right? Sometimes people come to me and they're like, 1 week before their IVF, how can I change my lifestyle? I mean, you can change, but these eggs have been in your body for 30 years by now. So these are chronic lifestyle changes that we can make, and the counseling should be as early as possible. Now, what are things we can change in our life to optimize our health for fertility, for conceiving? Of course, in women who have chronic medical issues, we're talking anything, high blood pressure, diabetes, obesity, anything like that. You want to try to get a handle on whatever's going on. If you need medication, if you are on medication, make sure they're optimized for pregnancy and that they are medications that you can continue during the pregnancy. Pregnancy is not the time to be experimenting with new medication. You want to try to control your medications before you become pregnant. Of course, weight loss if you have excess weight. Get on a prenatal vitamin. As far as environmental exposures, a lot of it is things that are common sense that apply to also to people who are not trying to get pregnant, right? We want to try to avoid plastics as much as we can. We want to try to avoid, pollution, all the chemicals that we're exposed to every day, all this, skincare products that we use. All these things, you want to look at the ingredients of what you're using and try to minimize as much as you can. Now, what we don't want is a patient so focused on the plastics and the chemicals that they forget the most important thing is that their age, right? A lot of people waste time sort of detoxing and getting on all sorts of programs and waste months and months in the 40s or years and years in the late 30s that, are very precious.
So avoiding exposures, avoiding these toxic issues, which again we have advanced so much in our lifetime that with the advancement in technology and our lifestyle, we will be exposed to all these quote unquote issues or toxins. But very important is that if somebody thinks that they've been because we are all exposed and they're actively trying to conceive or they've been struggling with infertility, they should keep in mind the factor of age. Obviously, you would want to be in an ideal condition for as long as possible. What people should understand is that, again, the eggs are inside that body which has been exposed for years and years and years. But if ideally would want to explain things, that egg before it being it's released, it starts its journey just about like 3 months before. So I always tell people 6 months in advance, if you want to prepare your body, that can be a good timing. Obviously, the longer the better.
Right.
If you are living in a place that everything is healthy, everything is everything is organic, everything doesn't have pesticides, all these issues, amazing. But if you're not,
who is, right?
Exactly. but if you're not, at least give it 6 months where you're paying attention. Again, 6 months if you're not someone in your 40s who you've been trying to conceive for a year or so, and it hasn't been happening.
Right. We don't stop our efforts. So I would never, as a fertility doctor, get a couple and then tell them, you know what, we're going to take 6 months off from trying to get you pregnant to detox.
Yeah.
That's not that, no fertility doctor will do that unless you're in your early 20s and we're facing something very significant like a very large BMI. We would never ask you to take a break from trying to get pregnant just to improve your exposures or anything like that. This is something you can do simultaneously while trying to get pregnant. Of course, if you're planning to start trying in 3 months or 6 months, as you mentioned, that's a good time to, do your best. We're talking no smoking, minimize alcohol. If you're drinking a lot of coffee, minimize that. 1 to 2 cups a day is fine. What else? Diet-wise, a lot of people talk about fertility diets and a fertility food. There are no fertility foods, but common sense things. You want to be as healthy as you can. We're talking fruits and vegetables, whole grains, and then, legumes, healthy fats, and everything else less very processed foods, less everything else. And without going crazy, right? Sometimes trying to conceive takes a long time. Pregnancy is very long. So if you drive yourself crazy,
right,
you burn out.
So going back to the diet, obviously, we talk about this all the time. But what I tell people is avoid ultra-processed foods, ultra-processed meats. And to make it simple, I tell them, imagine yourself on a Greek island or on the coast of the Mediterranean and somebody serving you fresh produce. That's what I want you to eat if you can. That quote unquote, the anti-inflammatory diet that has all the good fats, good proteins. And I tell them to, keep themselves on kind of anti-inflammatory
Mediterranean diet we grew up with is great.
Yeah. Exercise, you mentioned exercise. Are there any types of exercise that more helpful than others?
Not really. And moderate exercise, right? Anything in excess becomes too much.
Yeah.
So not exercising at all is not good for you. Exercising too much also can lead you to, lose your ovulation at some point. Exercise-induced amenorrhea is one thing. So everything in moderation.
Yeah. So I
3 times a week is good.
I counsel my patients to try to get in, if they can, 5 times a week, 30 minutes each kind of exercise, and to listen to their body. If they're too tired, do something that's light. If they're energetic, depending on where they are in their menstrual cycle, take advantage of it. Do some resistance exercise, especially if somebody's struggling with hormonal imbalance.
Right.
When should a patient see an infertility doctor? Other than, if they're trying to conceive, not that if they have a genetic issue that they want to plan ahead, not if, somebody has the luxury to just come and see you. Right. But people just don't walk into the fertility specialist. But when should they see a fertility specialist?
Well, people should walk into the fertility specialist. We're not very scary people, and we are accessible, we are available, and you can call and make an appointment with a fertility doctor. You don't necessarily have to be referred by your physician, just so you know. Now, who should see a fertility doctor? If you've been trying to get pregnant for a year or more and you are under the age of 35, you need to see a fertility doctor. If you have been trying for 6 months and you are 35 or older, you need to see a fertility doctor. If you are 40, you should see a fertility doctor. Not because necessarily we're going to find something, but so that we can investigate if there's anything and if we can help you get started as soon as possible. Especially there are couples who want more than one child and they are starting out in the 40s. That has to be planned ahead. I always tell my patients, it's like saving for retirement. We're all saving for retirement. Your ovaries retire. You can't show up at retirement and ask them to work. You have to save in advance, especially if you're planning to have more than one child in the 40s. This is something that has to be planned ahead.
Yeah.
It is possible, it is feasible, but many times it needs a little bit of help.
Yeah. So you mentioned 1 year if they're younger than 35 of actively trying to conceive, and then 6 months if they're above it. This is if everything is absolutely perfect.
This is if everything's absolutely perfect.
That they don't know, if they have endometriosis or if they have PCOS or if they have fibroids or if there's any genetic issue that they're aware of.
Right.
If somebody has these things, they should raise it with their doctor so that they are seen much earlier than that 1 year. Because if somebody suffers from PCOS and they're trying to conceive, and I tell them if you don't get pregnant in a year, come back to me. Well, they can come back in 5 years and they're still not pregnant.
Absolutely.
So,
if you have any of those issues, you need to see the fertility doctor right away. If you have PCOS and you're not ovulating regularly, it is very frustrating, and it is very hard to try to time your ovulation to be able to get pregnant. Not that you can't, but many times it comes more of a surprise rather than a planned pregnancy, because you don't know when you're ovulating. And it can become very frustrating. Endometriosis can cause a lot of inflammation in the pelvis. It can cause inflammation in the fallopian tubes, scarring in the fallopian tubes. It can cause lower ovarian reserve earlier in life. So if you have endometriosis and you know that you have endometriosis, you should see a fertility doctor right away if you're trying to get pregnant, just to get checked out, not necessarily to get treatment, but to get checked out. Make sure your fallopian tubes are open, your ovarian reserve is decent, and that everything is okay.
And I mean, because if somebody has endometriosis and they just let it be, and they come in their early 30s, they might be coming in as somebody in their mid 40s, in the sense of, with the lower ovarian reserve and the issues to get pregnant. So if there's an issue, people should see a fertility specialist way before than when they should.
Right. A new issue with the reproductive system. Someone who has very heavy periods, someone who has very painful periods. Sometimes I see women who can't go to work if they have their period. That's not normal.
Yeah.
That's not normal. If your period is so painful, you need to get checked out.
Yeah. What supplements do you recommend for your patients who are struggling with infertility to be on?
I usually prescribe a prenatal vitamin, and the prenatal vitamin I like to prescribe has CoQ10 in it, but if the prenatal vitamin that you are taking doesn't, I prescribe CoQ10 on the side. That's about the bulk of what I prescribe. And I see a lot of patients coming in with a long list of vitamins and herbals and things they bought on Amazon and things they bought at the pharmacy. A lot of it is untested infertility. A lot of it is untested infertility treatments. And sometimes when it comes to these things, less is more. And we have to keep in mind that not all supplements are created equal. So taking CoQ10, well, we have to which kind of CoQ10, how much are you taking? So these are all important things as well. So if you're seeing an OBGYN or a fertility doctor, you have to mention what vitamins you are taking.
Yeah, it's important to know that, when it gets to your level, when, unfortunately it's at the end of the frustration journey and people are really anxious and they come with all these things, and you want to optimize. If somebody's going to undergo fertility treatment, you want to optimize your outcome. You want to make sure that there's nothing else interfering with. What sort of tests should people, in general, have if they're struggling with infertility? What's like the basic thing that they should, again, before they get to you?
As in fertility testing?
Yeah.
Okay. I mean, sometimes patients come before they get any testing and we'll do all their testing. Sometimes if they have a gynecologist and they've mentioned this to their gynecologist, the OBGYN will order some testing before they come to us, and they'll bring the results with them as they come. If you're doing fertility testing, the bare minimum is an HSG, which is a hysterosalpingogram to check the fallopian tubes, and a semen analysis. No fertility testing is complete without those two. And you'd be surprised, but many people come in and they say, oh, my doctor did my fertility. They did a blood test. They checked my fertility. They told me everything's okay. You cannot check fertility in a blood test. That's probably an AMH, I'm guessing, what was checked. And they were told your AMH is okay. And unfortunately, that wastes the patient's time. Yeah. And leads to more frustration. You mentioned the frustration when people get to me. They shouldn't be so frustrated by the time they come to me if they hadn't wasted a lot of time. So at minimum, HSG, a semen analysis, and if you want to do an ultrasound and make sure that they don't have fibroids, etc., and ovarian reserve testing. So at least an AMH.
You mentioned something ultra important, which is the semen analysis. And I see this quite often, that women come to me as a fertility complaint first, alone.
Yeah.
And their partner is not there. And, aside from me asking about the history, if their partner is healthy, if the partner has, kids from a prior relationship, if he shaves his beard, every other day, not necessarily for shaving it, but that the beard is coming out. But that's, aside from the basic questions that I ask, I need to see the partner available for me to actually counsel him as well, that, about half of the time the problem is there, or both. You can have a small issue with ovulation, and then if the quality of the sperm is low, put them together, you have a big issue.
30% of the time, it's both.
Correct. So I struggle with that part when I tell them, we need to order a test for your partner. Luckily, more and more people are being aware, more and more men are open to the idea that, let me go check first. So second point that I want people to remember, if you're having issues with infertility, bring your partner so that we get things checked and tested, and we break the ice with the partner first and start asking him questions and get him tested, and also probably get his health optimized too.
Right.
Because
it for some reason infertility is considered a women issue, but as you mentioned, a third of the time it's both. A third of the time it's just the man. And you'd be surprised, but at the fertility clinic too, we mostly see just women. Yeah. Women show up without their partner, but it is very important to involve the male partner in any fertility conversation, because sperm is half of the equation.
Yeah. How do we optimize sperm health?
So, weight management is a big issue that I see. Big issue. Weight loss, management of the general health of the male, right? Yeah. Hypertension medications, diabetes medications, dyslipidemia, so elevated cholesterol. So the medication for cholesterol, all these things can affect your health, can affect libido. We need to make sure that he doesn't suffer from any sexual difficulties with ejaculation or erection, that sometimes men are very self-conscious to talk about and won't talk about. So these are all things that need to be addressed. And then we need the semen analysis, because even if you are perfectly healthy, you're not drinking, you're not smoking, you're not smoking marijuana also, which can affect the sperm quality, decrease the sperm motility. And we need to optimize the man's health in order to optimize the quality of the sperm. But even if you are completely healthy, we still need a semen analysis, because many times we don't know why.
Yeah. The whole misconception, as men can have kids all the way until they're 80. This whole thing, I need to get checked because you men can have kids until you're 80, but we forget about the toxic exposures, the daily, not necessarily toxic per se, because I'm not like talking about ingesting a toxin, but anything that can negatively affect you is considered a toxic exposure. Heat exposure, plastics, alcohol, smoking, whether it's tobacco, vaping, marijuana, lack of exercise, medications, supplements that people go to. I'm not talking about, creatine or like protein. I'm talking about, exogenous, somebody injecting testosterone. All these affect men's health. So it's a very big thing for the woman to actually educate her partner if they're trying to conceive. They should stay healthy.
Women know about the biological clock, even if they don't know the details of it. Everyone knows that at some point I can't have children anymore. Men have a biological clock. it is more forgiving. It's a lot more forgiving than women's biological clock. They can probably have children up to their 80s, but they're not immune to aging.
Yeah.
There is a decrease in sperm quality, in all sperm parameters as you age. And we see an increase in neurodevelopmental issues
Correct.
in children as men get older.
So to make this clearer, because it is a big thing. The older the man is, I'm not saying older 35, I'm talking older, 55 and older.
50.
There is increased risk of autism.
There is an increased risk of autism.
Just to make it simple, because that
from the man's age.
From the man's age.
That's different from
the
all
man's
the issues
age.
that are associated with aging a female. Just with the man being older, there is an increased risk.
But there is also the risk of having chromosomal problems, something similar to Down syndrome, trisomy 21. It could be any other trisomy that would lead to infertility because it leads to miscarriage. When I get couples who have, and had a miscarriage, I almost always test the products to see why.
Absolutely.
Why it happened. And luckily we have tests now that can tell you if there's a chromosomal problem and where it came from, whether it came from the dad's side or the mom's side. And I take that as an opportunity to, number one, give them closure. This is why it happened. Because if anybody suffers from a loss, the first thing is, why did it happen? Why me? This is why it happened. This is where it came from, not to blame anyone, but to kind of tell, this is where it came from, maybe optimize health, optimize your sperm health, etc., etc., etc. As men, as time passes, we're not time passes in our age, as time evolves, we are seeing that the sperm parameters are getting worse and worse.
Yes, they are. The sperm now is, we're making less quality sperm, let's say now, than years ago.
Yeah.
We're not really sure why, but everything that we talked about with our changing health, our increased exposures to all sorts of toxins, all of that has to have a role. I
mean, the way we dress up, the way we use our laptops, the way we're leading an unhealthy lifestyle, whether it's with alcohol, vaping, etc., etc.
And we didn't mention sleep. Sleep is very important. Sleep is how our bodies heal. We sleep less and less because we work more and more, and that applies for men and women.
So I was gonna get to those points next. Since you started with sleep, let's go ahead and start with sleep. What happens to your body when you sleep from a hormonal perspective?
So the hormones are different in the day and at night. Yeah. So some hormones surge in the morning, some hormones surge at night. And your sleep is extremely important for your hormone health, but also for your cellular health, right? Your cells are healing themselves when you sleep. And as we sleep less and less, as we stare at our screens more and more, the quality of our sleep is decreasing, and that is affecting our health. Definitely. But that's for men and for women. Yeah,
aside from the multitude of hormones, all these hormones that change between, there's two main hormones that affect sleep-wake up cycle. Cortisol, which is the stress hormone that you need it in certain amounts, not all the time, and melatonin in your sleep. And they are in harmony. And they affect the production of other hormones.
Absolutely. All hormones talk to each other. All your hormones talk to each other.
So my patients hear me talk all the time about their sleep wake up cycle, to respect their sleep wake up cycle. Sleep when you should be sleeping. Optimize your sleep. Your room has to be, dark, cold, comfortable, only for sleep.
Away from screens.
No screens, no phones. It's sometimes hard to stay away from phones. I tell them, if they're not an OB like me, they should leave their phone outside of their room. Yeah. Probably turn off the Wi-Fi. We don't know if the Wi-Fi has any issues, can cause any issues with, red blood cells, oxygenation, etc. And that can affect how your brain functions. And your brain gives orders to your organs to produce your hormones when they should be produced and when they shouldn't.
Let me know if you ever convince a patient to sleep with their phone outside the bedroom.
I have, actually. I have. I should convince myself to do it.
Me too.
Stress.
Okay. Stress is probably the most common question I am asked. I'm a fertility doctor. I don't see patients who are not stressed. To be clear, right? If you're trying to get pregnant and it's not working out, you're very stressed out, right? It's very stressful. And women and men tend to worry a lot about, is stress the reason I am having infertility? Probably not. Okay, while stress is bad for you, and while we want you to manage your stress, it's not really because your stress is causing your infertility. Stress is harmful in a lot of ways to your general health, and it affects your mood. It affects your libido. It affects how your brain is processing information. I have patients who are so stressed out that while I am talking to them, they're not registering what I'm saying because they are so nervous. They're so stressed out. They're making mistakes with their medications. They're forgetting when their appointment is. They can't come and see me to start with. A lot of patients don't come to see the fertility doctor because they're so stressed out and they're worried that we're going to give them more information to stress about. And stress will harm your fertility in that way, meaning it will become an obstacle in your way. Another obstacle for you to get to where you need to get. So we want you to manage your stress levels, whether it's with exercise, whether it's with meditation, whatever works for you. And I don't want people to worry about stress causing necessarily their infertility, because really we don't have any studies showing that, but also because I don't like people taking blame for their infertility.
Because it can cause more stress.
It can cause more stress, right? People get stressed out trying to eliminate stress from their lives. How can you eliminate stress from your life? We're all stressed out, right? We're all very busy. Most of my patients are professional women who are trying to juggle work. Some of them are already mothers, so trying to work all day, trying to be a mother, and trying to juggle fertility treatments and hormones and injections and timings and appointments. It is stressful. And nobody expects you to be in a fertility clinic and not be stressed out, but you have to do what you can to manage the overwhelming anxiety and stress that comes with from being a human in a very fast world.
So stress is normal in certain amounts, in certain spikes. It cannot be present all the time. If your body is unable to cope with stress, you will die.
Right.
And you need to respond to stress. I mean, it's a very innate response that we've had. Imagine 1,000 years ago, if you're in the wilderness and you see a wild animal running at you, your cortisol is going to spike up and you're going to run away.
Right.
But imagine if that lion is chasing you 24/7.
Yes.
If the lion doesn't eat you, you will die from the stress. So that's where the balance has to come. Everything works better if you unplug it for a little bit and then you plug it again. So that's why people need to take a break from whatever is stressing them out. Be conscious, again, as you mentioned, whether it's exercise, meditation, guided meditation, breathing exercises, all sorts of things that kind of balances out
find what works for you when it comes to stress relief. It doesn't have to be something specific. For example, I have patients who do acupuncture and feel much better. And I have patients who are so stressed out about making it to the acupuncture appointment that it's working against what we're trying to achieve. So it's not a list of things that you have to do to relieve stress. You find what works for you. If spending time with your family is what relieves your stress, then do that. If your family is stressing you out, then
go play with your pet.
Go play with your pet.
Go play with your pet. Yeah, it is not a cause of fertility, but it's definitely not helping with fertility.
It's associated, definitely.
The way cortisol is produced in the body is along the same pathway where your sex hormones are being produced, whether it's estradiol, progesterone, testosterone, etc., etc. What are the final thoughts that we're gonna give to our listeners today?
I hope if our listeners get anything from today's talk is fertility doctors are not scary, and they're available. And if you need to talk to someone about your fertility, we're available. Your gynecologists are a great resource, but they're, you guys have to address so many things in your visit and do the pap smear and the well women visit and, breast exams and mammograms and, so many things that you're dealing with that sometimes patients don't bring up their fertility and don't address it. So we're here for that. Keep in mind your age, which is, of all the things we talked about, the most important thing when it comes to fertility, the most important determinant of whether you're going to get pregnant or not, with or without fertility treatment, is going to be your age. Make sure that you are taking care of your lifestyle, of your health, addressing everything that you can and you have control over in your life. And remember that infertility is a disease. You did not bring infertility upon yourself. So shed the blame, shed the guilt, and if you have infertility, address it early.
Yeah. I want to tell them, don't be shy to ask your friends, ask your family members, ask your OBGYN, ask your primary about your fertility in general. Whether you're in your 20s, you're in your 30s, in your 40s, do not put it away, even if you're healthy. If you're not healthy, that should be another reason for you not to put it away. Don't be shy to talk about it. Optimize your health as much as you can, even if you're not trying to have a baby, because down the line you might.
Absolutely.
So you want to preserve your ovaries, you want to preserve your eggs and keep them as healthy as possible. Talk to your partner, because they are a big part of this fertility journey. If you don't have a partner, then if you're in your early 30s, don't be shy about thinking and planning ahead to, put that extra money in the bank. And obviously put the blame away.
Right. Shed the blame, shed the guilt, and address it head on.
Laurice, I want to thank you so much for being our first guest on Reframe Your Health podcast.
My pleasure.
We will be having more episodes on fertility, how to optimize your fertility when you're younger, when you're not struggling with infertility, and even also when you're older, how to optimize your health, how to optimize your ovarian health, how to keep yourself healthier, fertile, longer. Thank you so much.
Thank you.